I will call to order this hybrid meeting of the Clark County Commission on Aging. It is August 17th, 2022. My name is Cass Friedland, and I'm chair of the commission. Due to COVID-19, meetings of the Clark County Commission on Aging are being held in a hybrid meeting room. This means commission members and guests and members of the public have the option to attend in person or remotely. For members of the public attending remotely, other event participants cannot see or hear you unless you are acknowledged by the commission chair or staff and your audio is unmuted. I will be announcing the agenda items as we move through the meeting topics in case you do not have the agenda in front of you. And there will be two opportunities for public comment during today's meeting. The first opportunity will be during the moderated fireside chat discussion. And the second opportunity will be a general public comment period for any comments not related to our presentation this evening. Before we get to opportunities for you to provide comment, we'll provide a short announcement of how that works and how you can join us. The evening's agenda is planned as follows. We first have the approval of the agenda, approval of meeting notes, the moderated discussion with a peer-to-peer educator, and general public comment. And finally, communications and announcements. We will start with a roll call of commission members who are present for this meeting. Commission members, please say, "I'm here," after I call your name. And as a reminder to all of us, please don't forget to mute yourself when you're not speaking. Sue Cameron.
I'm here.
Chuck Green.
I'm here.
Amy Gross. I believe Amy is in a beautiful place visiting her grandson, so she's not here. Franklin Johnson. I think Franklin is on his way. Megan McCarthy.
I'm here.
Mel Sanchez.
I'm here.
Larry Smith.
I am here.
Tanya Stewart.
I'm here.
And I'm Cass Friedland, and I am here too. I believe we have a quorum. Next, I will take a motion for approval of today's meeting agenda.
Madam Chair, oh, sorry.
Second.
Wait, no, I'm not moving yet. Madam Chair, I'd like to amend the agenda to add an item after the general public comments for a motion to recognize the county council.
All those in favor of approving the agenda as amended?
We probably need a motion to approve the amended agenda first. So I think Larry,
Make a motion to
Larry
approve?
meant to make that, right?
Okay. So we need a motion to approve the amendment to the agenda.
Yes. Yes. So moved.
A second. Thank you, Mel.
Second.
All those in favor of approving the agenda as amended?
Aye. Aye.
Aye.
Aye.
It looks as though that that has passed. Let's see, so next so the motion has passed. So we will move on next to the meeting notes. I'd like to take a motion for the approval of the July 20th meeting notes.
Madam Chair, I'd like to amend the minutes for July 20th to add that the Commission recognized C-TRAN as the American Public Transportation Association's Transit System of the Year, somewhere toward the end of the meeting.
Wonderful. Need a motion to approve the agenda as amended for the meeting notes?
So moved.
That would be the meeting notes. just
Meeting notes.
correct that, yeah,
So moved.
and second.
Then, let's see, all in favor of approving the meeting notes as amended? Please say aye.
Aye?
Aye.
And that motion has passed. Thank you, everyone. Next, our next agenda item will be a moderated discussion or the fireside chat on the innovation through connection with our guest who has been invited to speak about peer-to-peer education. And Megan will be moderating this evening's discussion. Franklin may be joining us soon. But Megan, could you please take it away?
Of course. I'm very excited to introduce our guest. I'm going to read a short bio so we can all get to know her. And feel free to add in if there's anything that I missed or that you want to focus on, and then we'll start our discussion. So Chastity Charette is currently the Community Services Health Educator at the Area Agency on Aging and Disabilities of Southwest Washington, or AAADSW. She has worked there for 5 years in multiple roles, the longest in the Aging and Disability Resource Center as a resource specialist. In her current role, she wears many hats that allow her to connect with clients, community members, and partners, as well as coworkers. She sits on several committees, including Dementia Friends, Life Transitions, and the Dementia Action Collaborative. She has a bachelor's degree in human services, focusing on gerontology. She loves working with and for the aging population. Alongside her career, she is also a wife, mom, daughter, sister, niece, godmother, cousin, and friend to some extraordinary people. Well, you sound like our kind of people. So we're very happy that you are joining us today. Did I get anything incorrect or anything else you wanted to add to that bio as people are getting to know you?
No, Megan, you did wonderful. Thank you so much for that.
Well, I'm going to start with just some general questions again, and later on we'll have some opportunity for the rest of the council to weigh in there. But let's just start with how do you feel like you connect most effectively with community members? And that could be multiple ways.
Okay. Well, Pearls, or the program to encourage active, rewarding lives, is a program that's really adaptable in meeting community members' needs exactly where they're at. Pearls is most effective in connecting with the community because it is a program that is utilized by agencies that are already serving community members. This includes agencies like Oswald, like where I work, or even like YMCA or local senior centers. They utilize Pearls for their clients' needs. Pearls is supervised by UW's Health Promotion Research Center, which is always continuing to expand Pearls partnerships with those different community-based service agencies.
That's great. So of everything you would want the community to know, what do you think is the information that you work the hardest to share, or the communication that you think is most valuable to our community members?
I would say that the Pearls program even exists.
Yeah, yes.
I
Maybe
think that
it's a good time to take a little step back, because
yeah.
and this is something I didn't know about in advance, and the UW collaboration was really interesting to me and how that works. So maybe we spend just a little more time on some of the logistics and the details so that we can all be on the same page.
Yeah, so Pearls is an acronym for Program to Encourage Active, Rewarding Lives, and it's targeted mostly for older adults. It's a community-based treatment program for adults with mild depression or ongoing low-grade depression. Both of these things are especially common in like family caregivers, as well as older adults who are socially isolated or physically impaired. Pearls is highly effective treatment method shown to reduce depressive symptoms, improve quality of life. The health educator department at Odswa manages the Pearls Coach, which is me. But it's kind of funny to say that the health education department manages me when I am the health education department. But I do have a supervisor. So anyways, and I'm also supervised by a licensed psychiatrist at UW, Dr. Mark Snowden. So we do what's called psych soups, and we connect and talk about clients and how I can better serve them. The Pearls Coach, I facilitate about 6 to 8 sessions focused on brief behavioral techniques, which are to empower those individuals to take action and make lasting changes in their lives through problem-solving therapy. The delivery method of Pearls is built on evidence that is home-based treatment, which reduces depression symptoms and is most effective, we're finding, in folks that are socially isolated, that are older, and that even things like lack of respite care, challenges with ambulation or transportation. And so with Pearls, I'm able to have regular contact with clients that is actually, I don't want to say it's better than, but is a little bit more effective than like an outpatient setting. But unfortunately, with COVID, the number of participants has been lacking due to the restrictions of in-person visits. So yeah, that's kind of like the lowdown on Pearls and how I kind of look at it and how it's been presented to me.
Is there a cost to participate in the program or to receive services?
No. So for us to facilitate Pearls, we facilitate it to clients that we're already serving. But there is an ability to also serve folks if I receive a referral from like a provider at a clinic. They can also refer a client for Pearls, and I can take that person on if I have the funding for it.
Okay, great. And then do you have a success story, obviously without sharing any personal details, or a story that might illustrate how great and wonderful the program is?
I do actually. I have a current client. She is a caregiver to her husband who has dementia. It's early onset. He was just recently diagnosed. Um, and I'm not sure if anyone's familiar with the PHQ-9 score, but that can vary for folks, but high level is like 19 plus, right? And she was kind of starting there at like a 19 on her PHQ-9, and we've had about 5 sessions, and she's now down to a 6. She's able to think of something that's going on or think of a solution to things that are going on, and connecting with her own, like, because I'm not a therapist or licensed to do that type of help, but she took it upon herself to seek out that. Based on our conversation. So far with that, it's going pretty well. I have not been a Pearls coach for very long, just since May. So I'm pretty new to this. So for right now, she is my success. Absolutely.
That's wonderful. So I'm just going to summarize in case some people aren't familiar. But so basically, she was screened for depression and had some concerns of being at risk, and that led to identifying ways outside of really medical interventions that she could increase her daily joy or her ability, her activities of daily life, and sooner rather than later. So would that be a fair description, that this is maybe one like early intervention opportunity?
Yes, absolutely it is. She is a client of ours in our family caregiver support program. And so her case manager administered a PHQ-9 to her during an assessment. And that's where the score was so high. And they're like, oh, we need to intervene. So.
Great. Well, it sounds like we're very lucky to have this in our community. But it sounds like there's also Pearls programs functioning all over the state of Washington under this funding model with the UW.
Yes, Pearls is nationwide. The housing of it is just at UW, but they reach out to many, many organizations all over the nation.
Okay, great. This is kind of a more outside the box question, but maybe as in the work that you do, can you think of any like future technology or any innovations that might help you deepen your connections with aging adults, or things that you see, wish or dream for on the horizon? As you know, you're very knowledgeable about this population. What would you do if you could wave a magic wand?
Oh, goodness. Okay. Well, that is there's a laundry list of things that I would like to do. But I think
I think the commission, we always are striving to see how we might be able to connect dots, or but we can't dream it unless professionals like you share it. So again, it's more of, you can, as a blue sky kind of
Mhm.
top of your head question.
I think for me, if there was a way to reach the underserved population, those that are, either don't fit the mold for cultural reasons or religious reasons, how can we create programs to serve them that meets their religious or cultural needs, as well as the folks that are living in rural areas? Like, uh, I could probably count on one hand how many clients we have that live in Amboy or Carson, because it's just hard to reach them.
Yeah. And then are you able to use any telehealth, or, I mean, those technology pieces now to reach some of those more rural populations, or is it still pretty limited?
So I have, as a Pearls coach and a health educator, I'm able to meet people in their homes if I'm allowed. Obviously, with COVID restrictions, it comes and goes. But with the technology now, I am able to reach more people because I can do it over Zoom. I can do it on the phone. Um, so technology has given me the ability to do those things, to reach more people. But it's getting the word out there, because it's hard to just go to a community event in Carson and just say, "Hey, we're Oswa and this is what we offer, and I'm a Pearls coach and this is what Pearls is," because people kind of just wave it off sometimes. So, but technology has given me the ability to reach a vast majority of people in the area. Yeah.
Building trust is always a challenge, in reaching communities when, and that connection. So communication and the trust building. Is there anything when you visit a patient in their home and you're able to be in their space that you think is significant learning that you sometimes can't get from a screen?
Oh, yes, absolutely.
Will
Um,
you say a little bit about that?
yes, because I'm a very I talk with my hands, if you can't tell. So when I'm on the phone or I'm in Zoom, I can't show as much empathy as I would like, for folks when I'm in person, because I can say, you know what, I'm 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 getting what you're saying to me. Is it okay if I just put my hand on your shoulder? Or like, do you need a hug? Like,
Uh,
and people sometimes need that. Like the touch is so needed, especially for what I do. So yeah, definitely in person, 100% is the way I would go if I could.
That is really priceless.
Yes.
I know Tanya Stewart, who's a provider on our convention, will identify with that and the ability to touch. And that has been one of the things through COVID that has become really challenging, asking people for their consent, building trust, making sure they feel comfortable. But in the absence of that, I think a lot of individuals have realized just how important it is, from
Yes.
babies all the way through the
Hmm.
aging continuum. So
Yes.
that alone is a very powerful takeaway, to hear that. And then when people have their family members or loved ones far away and they're not able, that I'm sure that it brings a lot of comfort to friends and family if you are able to go in and just provide some human to human support, in addition to all of our wonderful technology.
Yes. Yeah.
Okay, this is my last question I have for you, and I know that our council will have lots of questions as well, so I want to make sure they get enough time to speak to their individual interests. But just one more touch on any of the challenges that you're continuing to face about connecting and communicating with community members. So we talked a little bit about just the awareness of the programs that exist. I tried to hit on that it's free, because I think sometimes when we were just not unsure, and there can be some embarrassment about asking, and do I take my insurance, and that creates a lot of anxiety around it. So just knowing that it's a free service available, how to reach you, and then we talked a little bit about building trust so that people feel comfortable, which sometimes takes time. Are there any other barriers that you face or that you have concerns with when you're trying to connect with our community?
Um, I don't, besides not being able to reach out to the folks that, it- what's a good answer? Like when I think about how difficult it can be to communicate with just our community, I think about the folks that, like I said, aren't thinking about services because it's either culturally not okay or it goes against their religion or for whatever reason they don't want or can't seek out that help. So I think that the difficulty is trying to reach those folks and let them know that other than, respite care, aging and disabilities really does have a plethora of programs that can be helpful in many different ways, even if it's just like transportation. So the challenge for me and I think for a lot of folks is just reaching those people, like letting them know it's okay that you don't want caregiver services or you don't want pearls because you don't believe in that kind of intervention, but there is other things out there that can be helpful for you.
So not to put everything in one bucket, the I don't need help bucket, and
Mm-hmm.
automatically say no to anything. And
Yes.
my guess is that probably once people take advantage of one of the services or do build some of that trust, then it can lead to other supports down the road, as needed.
Yes.
Mm. Okay, well, that's wonderful. Cass, I'm going to hand it back over to you to see if what exciting questions we have.
Thank you so much, Megan. We'd first like to hear questions and answers from the commission, and then we'll go to the public. Are there any commission members that have questions for our wonderful speaker?
All right,
Mel?
just one question. How many clients, number of clients you're dealing with, and is there a maximum number or what? How does that managed?
So I have a very extensive Excel spreadsheet that I keep. I have a max client list of 24. And that's because I see people, the way the sessions are broken down is I see someone once a week for 3 weeks, and then once every other week, and then once a month, and then 3 phone calls. So I have to keep it balanced to where I don't have too many people on my caseload, so that way I'm able to provide the best quality Pearl service I can. So my max is 24, and that's just for my sanity, for being able to serve Pearls properly, as well as funding.
And Mel, I know you had a question.
I think I have a couple of questions. It's a wonderful program that you have, appropriately named, and you have an appropriate name guiding this program, Chastity.
Thank you.
Question number one, you say you're limited to 24 clients. Are you overwhelmed, number one? Are you overwhelmed with that number? Is it maxed out now? And number two, if we wanted to refer a person to your program, how would a person go about doing that?
So I am not even nearly close to my max. I have 3 clients because we are under strict COVID restrictions on being able to meet people in person. So I've only been able to hit 3, only because people want that in-person interaction. And so no. And I think at 24, they kind of maxed that out just because of funding, because I grab money to pay for pearls from different programs within ODSWA. So 24 is the max just for funding purposes, and I'm not even close to that yet. And then to participate in Pearls, you would need to either be enrolled in one of our programs, and that could be Medicaid long-term care, um, health homes, care coordination, kinship, family caregiver support, those programs. But a person also can be referred by their provider through our GWEC referral system.
Thank you.
Mhm.
Am I seeing any other hands from commission members? Questions?
Um, I raised my virtual hand. I'm not sure if you get an alert on that.
Tanya, please.
Yes, thank you so much. Wonderful discussion, Chastity, and great presentation. Thank you. I have two questions. Some of them were answered pretty much already, but I'll throw a few things out there. So referrals, doctors can refer. So you're saying providers, clinicians can refer to you. Is that, first question is that a big referral source for you, the primary referral source for you? Because certainly I did not know anything about this when I was doing primary care. So things like this would have been helpful. So how are we getting the word out on that? Then the second part of the question is really scalability. So, I get that you are currently seeing 3, that's awesome, and you're capped at 24, which you need like sanity. There's only so many hours in a day. How there are so many folks who are in need. So thinking about the growth and the longevity of the program, how is your team tackling that to make sure that it doesn't go away in a couple of years?
Those are great questions, Tanya. So for Pearls, I do outreach events. I go to places and I talk about the agency, but I also talk about Pearls and what I do as a health educator. So that's how I really get the word out. But our GWEC provider liaison, Brianne Swanson, she connects to different clinics and providers and talks about ODSWA, as well as, going over what that referral form looks like. And if they have questions, then she kind of elaborates on what's within the referral. So in our referrals, it says, the provider wants to refer the patient for transportation or caregiver support or Pearls. And if the provider who's receiving the presentation and ask, what is Pearls, then Brianne will, elaborate on what Pearls is and how they can refer. Now, providers know the referrals that I get from them. No, I don't get very many. And I don't think it's because of lack of knowledge or lack of our ability to provide them information on the program. I just think it's something that a lot of folks who aren't already connected to ODSWA itself, they feel a little hesitant in saying yes to. Because with Pearls, the provider can refer them, but they do have to have consent. Like the referral has to be signed saying, I talked with the patient, their PHQ-9 was this, and I got their consent to refer for Pearls. So that might also be a barrier to why I don't get too many from providers. But on the other side, because of funding, I can't take too many from providers because that funding comes from a very limited pot of money. So let's say in a 6 period, I could take maybe 2 referrals from providers. Now, if I see an uptick in providers referring for Pearls, then I could potentially open it up to taking more of those types of clients, and then asking, the state, ALTSA, DSHS for more funding to provide services to those referrers. Yeah.
Sorry, but I have a couple of more questions. Okay, number one, is there a minimum age for your clients? And then, what was my second question? Go ahead and answer that one. Maybe I'll remember my second question.
Yes. So clients, actually, no. Yes, kind of. I would say they have to be at least 18, um, which I know is kind of silly to say out loud because usually it's like, oh, aging and disabilities, like it's 60, like, but actually it's 18 for Pearls programs because I can receive referrals from our health homes care coordinators, which serve the population from birth to, 100 years old. So.
Okay, my second question was, will you be able to provide us with a list of the different organizations from which clients can be referred? I know we talked about providers, but you talked about several other programs that I'm really not familiar with. Will you be able to provide us with a list of those different organizations?
Well, it's really only two ways. So it's an internal referral. So from a case manager or a care coordinator within our agency refers people to me, or it's a provider from a clinic. So the Vancouver Clinic, Kaiser, those folks can refer. So there's only really two ways that I get referrals.
I have a question. I'm not sure if, does anyone else have their hand up? Because I don't see any other hands up. Okay, I have a question. So thank you so much, by the way, for this really terrific information. But one of the things that we've been exploring this year are these, sort of breaks in communication of people being able to find ways to seek out and get the services that they're sort of looking for. And that there are many barriers, and you already mentioned the idea of that folks may have some barriers in being able to, with paperwork and being able to refer and such. I was wondering, what would that look like for you if those barriers could tumble away and there could be some kind of a free exchange between your services and the folks who need the services? What could that possibly look like? What kind of barriers would you love to remove?
Well, I think the first thing would be unlimited amount of funding. I think that's probably one of the biggest barriers for any program is the lack of funding, or maybe funding is very limited. Um, I would also maybe be able to connect more with providers, and that's not saying that what we're doing now is ineffective, but if I could maybe do more presentations or maybe educate providers on what Pearls is, I might get more referrals from them. Um, but yeah, funding for sure. Like if that could just be a limit or unlimited, I would be golden.
And just a follow-up question, if I could. So, since this is a program that right now is quite lean, and you're doing, this tremendous work yourself, do you have the ability to link with other types of teams or people that could help extend communicating your work to others? Do you have any partnerships or, folks who are really good with communication, who are working with you presently, or is it kind of like you?
Well, with having the GWEC provider liaison, she does do an extensive amount of work getting the word out, just not only about the agency, but also with Pearls, and educating providers on how and what Pearls is. And so I think that she does a great job on that end. I feel like when someone calls in, and I have, a few years in the Aging and Disability Resource Center. And so when we would get a call in and someone would say, I'm socially isolated, or I'm feeling down, our Aging and Disability Resource Specialists, they can't make referrals to Pearls. So if that's something that we could open up, then that might be helpful as well. But also, like, I can't take an influx because of funding. I can't take an influx because it's only me. So if we could break down those barriers and try to bring in more clients and outreach with the ability to um, provide services to all of those that we outreach, I think that that would be um, helpful, very much so. But then that would require funding and potentially hiring some more Pearls coaches.
Thank you so much. Are there any other questions from commission members? Am I missing any little hands up here? Does anyone see any other? No? No? Well, perhaps I could open it up to public comments right now. And would this be where we would go to the online? I don't think there's anybody present who will speak. So let me pass that on over to you, Susan.
Yes, we do have a few people online, so I will read the directions on how to participate. For attendees using their computer or WebEx application, if you'd like to speak, please utilize the raised hand icon. You can do this by clicking the participant button or icon, the location of which depends on the device you are using. Staff will only acknowledge those attendees during the public comment period who have raised their hand by selecting the hand icon. When you're acknowledged, you will be unmuted, and when you have finished your comment, please click the hand icon again to lower your hand. For attendees using the telephone, you need to press *3 on your phone's number panel to raise your hand. When you are acknowledged, you will be unmuted, and when you've finished your comment, please press *3 again to lower your hand. And we do have one person raising their hand. I'm going to unmute Christina Marnera now.
Good afternoon. Thank you for giving me a couple minutes to chat. One, I just want to say job well done, Chastity, in presenting and sharing information about the Pearls program. And I wanted to just follow up to Tanya's question around capacity for expansion and sustainability. We are very fortunate here at the agency. Our director has a commitment and an understanding of the role of programs like this, contributing to the overall health of community. And so we really did launch this program at his urging. And so as we see the need increase, we will then look to see how we can expand the program. And so we really will look at it in terms of growth. We think we have a terrific coach in Chastity. We look forward to sharing more about the program and community and the growth of it. So there is the opportunity for it. Our philosophy here at the agency too is we're very thoughtful about how we introduce programs. We're very reluctant to introduce something that's here today, gone tomorrow, that really doesn't serve anyone very well. And so we look forward to having that, the need to worry about that, it's time to think about growth for the program. So.
Wonderful, thank you. Thank you so much, Christina. Any other questions from the public?
I do not see any other raised hands.
Well, I have to say, I want to thank you so much, Chastity, for joining us this evening and for sharing your expertise with us. And I myself, and I know that all of my colleagues here have learned so much about Pearls, the important work that you're doing, and now we can all be advocates for your work. We can let others know. We can help send out word into the community for you. It's your opportunity now, if you so choose, to exit, if you would like, from our proceedings. You can certainly stay with us for the rest of the meeting if you'd like, but we want to thank you again so much for taking the time and joining us today and sharing, again, your wonderful program and your expertise, and we wish you the best.
Thank you. Thank you so much. I really appreciate you guys having me and the opportunity to speak to all to you today.
So before we leave, I wanted to sort of have the commission download, check with the rest of the commission on any key takeaways or potential connections that we might be able to make based upon the hearing about pearls from Chastity and the fireside chat. I'm not sure that I see any hands. Am I missing anything, Jenna and Susan? No? Looks good? Yeah? Well, thank you. And thank you, Megan, again, for your support of this really great conversation. So I think that right now we're going to move to general public comment, if that's correct. And if you are in the meeting room and would like to make a public comment, we have no one in the room here that I see to make it, but if for anyone joining remotely, staff will provide instructions on how to make a public comment.
For attendees using their computer or WebEx application, if you'd like to speak, please raise your virtual hand. And for attendees using the telephone only, you need to press *3 on your phone to raise your hand. And I am not seeing any raised hands.
No raised hands. Wonderful. Thank you so much. Thank you so much. And of course, everyone knows if they have questions about pearls, that Chastity will be more than willing to answer questions. So for commission members, are there any clarifications or questions that you heard today that you'd like to share? I don't see any raised hands. I don't think. No, Larry, that was you scratching. Okay. So I think what we're going to move on then, if we can, to our communications and announcements portion of this meeting.
Madam Chair, we added an agenda item before this.
For the letter for the chair, co-chair. Thank you. Yeah. So we had a conversation in our earlier meeting about sending a letter from the chair and co-chair of the commission to the county council, thanking them so much for their tremendous support for our refresh and expansion of our aging readiness plan. So I think, I guess I would anyone like to make a motion to allow the chair and co-chair to send a letter to the county council?
So moved.
Do I have a second?
Second.
Thank you so much, Larry. So it sounds as if we have approved sending a letter. So Franklin, you and I can work on a letter to send them, and after our tremendous evening yesterday evening with the...
Madam Chair, just out of procedures, could we actually have a vote on that?
Oh, thank you so much.
Yep.
Thank you so much, Chuck. So to have a vote... So I'd like to request a vote. All those who are in favor to say aye.
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 Thank you so much, Chuck. So it seems as if the motion passes. So now, Franklin, you and I will will send a letter to them. Wonderful. So the next item, nominations for the Commission's Silver Citizen Award are now open. I know that we've all received emails. Nominations are due by 5 p.m. on August 26th. The details and a copy of the nomination form are available on the Commission on Aging webpage. And if you have any questions, please reach out to Jenna and Susan. I'd like to also see if there are any other announcements for the good of the order.
Cass, you attended a forum this morning, and you briefed us in the work session, but I think for the benefit of our listening public, I think it was such an important roundtable that you were part of. I wonder if you could summarize that again.
Thank you, Chuck. It would be my pleasure. It was a great honor to be invited to participate in a roundtable with Senator Patty Murray this morning around the really important work going on with the prescription drug pricing. It took place in the ADSWA conference room, and it was a really lovely, intimate gathering in which we were able to share stories of how really skyrocketing prescription drug costs and the changes that we're going to be seeing in the future as a result of the work that's going on in Washington for us now. So we were able to share some stories directly with the senator, and she listened to our stories. Some were really amazing stories from the community of people having to do things such as share insulin, to not be able to even purchase medications because you had to pay for housing and pay for food and transportation. So it was about 45 minutes of just a very quiet, very meaningful conversation. And we did have members of the press there, so I'm looking forward to seeing the stories that are going to be coming out of it, and I'm really, really, really thankful for the Senator's office and staff reaching out to us.
Cass, can you describe the participants a little bit?
Oh, yes, absolutely. We had a member of LULAC. We had the former president of NAACP Vancouver, and then we had two members of ADSWA. We had Mike and Lisa from ADSWA who were there as well, and Pat from LULAC, and Bridget from formerly of NAACP. So we were all asked to just sort of share for 5 minutes some meaningful information and stories so that the senator can, as people said, put air underneath her wings to realize how important legislation is, and how prescription drug costs and putting caps on Medicare and the amount of spending that's done for prescription drugs under Medicare, just to kind of give her the strength to go back and continue the good fight. Any other questions right now about that? I don't think I see any hands up. Well, our next regular meeting is going to take place on September 21st, and we're going to be speaking about volunteer coordinators. I think I'm handling that one during our fireside chat. Are there any other agenda items that anyone would like to discuss?
Now, Cass, I just had one that I mentioned in our workshop a little bit earlier, and it's a good thing about our community and the city. The city of Vancouver has been recognized as a veteran-friendly city by the newspaper, the Stars and Stripes, which is a private military publication that's been around a long time. That award is scheduled for the 26th at 9:30 at City Hall. There'll be representatives from Washington to present that award. It's one of very few cities that get recognized, and it's recognized for its services it provides veterans, its activities, its events, and so forth. So there's a whole array. I mentioned this, and I mentioned it to the mayor. Although it's directed, at Vancouver, it really applies to all Clark County, because Ridgefield, Battleground, and Camas, and Washougal all do various activities to promote and make sure that veterans are taken care of. So I just want to mention that. There'll be something in the paper shortly.
What an honor. That's fabulous. Thank you so much for sharing that, Larry.
It's 26 at 9:30 at City Hall when the award presentation, and the individuals coming from Washington are traveling to several different cities to present a similar type award. But there should be something in the paper shortly.
So I'd like to add that our September meeting, where I'll attempt to join from half a world away, we also will be kicking off with our consultant, the Aging Readiness Plan update. So I believe it would be attended by Rose Newberry, who's the project manager for DUDEC. And I guess I can say that because the county council approved their contract last night. So we'll look forward to that and look forward to the community joining in that, because that will be the official start of updating our now 10-year-old plan.
That's going to be an exciting year ahead, and thank you so much, Chuck, and we do want those who are listening to know that we are going to be having a very active participant program. Please reach out to us if you know of groups or even yourself who would like to help participate in the future in really advancing and renewing and adding a new chapter, actually, to the Aging Readiness Plan. So we are very, very excited, and we are so thankful to the County Council for helping us move forward on that. Anything else anyone would like to bring up? Well then, first of all, we send warm wishes to Amy as she cuddles her grandchild in California. With that, I guess this meeting is adjourned. Thank you all so much.
Thank you, Cass, for your first meeting.